Hello guys, I'm Dr. Jeevan Kharel and today we are going to study about the anatomy of mandible. The mandible can be broadly classified into two parts, the horizontal part and the vertical part. The horizontal part, this is the horizontal part and it is called body, and this is the vertical part. This is the vertical part and it is called ramus. So there are two ramus in a mandible, one in each half and body. The left and right half, the left and right half of mandible fuses each other by mandibular symphysis. This is mandibular symphysis. The space here, we can see there is a space between the two half. This is left and this is right, and this space is called mandibular space. Okay, now let's study about the left mandibular mandible. This is as I have already mentioned, this is the horizontal part of the mandible, so it is called body, and this is the vertical part of the mandible, so it is called ramus. The body is further classified into two parts, the anterior incisive part and the posterior molar part. The anterior incisive part consists of alveolar socket. This is alveolar socket, in which the incisive teeth are lodged. So total of four incisor teeth in each half, and total of 8 incisor teeth in mandibular are present. At its anterolateral aspect, we can see this is the mental foramen, which forms the anterior opening of the mandibular canal. Okay, now this is the molar part or posterior part of the body. At its dorsal end, we can see the teeth. This is first premolar, second premolar, third premolar, and this is first molar, second molar, and third molar. So total of 6 teeth are present in the dorsal border of the body in each half. This is the ventral end of the body, which is thick. Okay, now let's study about the vertical part of the mandible. This is the vertical part of the mandible, which is called ramus. It is upper end or dorsal end. We can see conoid process, which articulates with the temporal fossa of the skull, while this is the condylar process, which articulates with the squamous part of the temporal bone. Between conoid process and condylar process, we can see a notch. This is mandibular notch, and just below the this part, we can see this is a neck. The horizontal part and the vertical part forms an angle. This is called angle of mandible or jaw of angle of jaw or mandibular angle. The medial surface, in medial surface, this is the medial surface. In medial surface, we can see this is mandibular foramen. This is mandibular foramen, which forms the posterior opening of the mandibular canal, and it gives the passage of the mandibular nerve. Just below it, we can see the notch. This is the groove for the lingual nerve. Okay, medial side can be easily distinguished by the presence of this mandibular symphysis, which fuses with the another half of the mandible. And lateral surface can be easily identified by the presence of mental foramen. It is anterior lateral aspect. Okay, this was all about the mandible, and I think I have completed all about a mandible. If there is any queries, you guys can ask me. Thank you everyone, have a great day. Bye bye.